Dr. Manish Trivedi of AtlantiCare discusses an important milestone on the kickoff of the COVID vaccinations here in Atlantic County. Plus, we discuss an important tradition of Three Kings taking place in Atlantic City. It's all here on the next Latino Motion. Join us.
Choose to get lost in the woods to gain experience in forest management.
Choose to travel through time to understand the past.
Choose to soar to pursue a career in dance.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation, and Stockton University. This edition of Latino Motion with Bert Lopez is brought to you by the HD Studios at the campus of Stockton University.
Funding for Latino Motion is provided by AtlantiCare, offering primary, specialty, and urgent care, plus surgery and more. Atlantic City Electric, energy for a changing world. And South Jersey Gas.
Health disparities in the Hispanic community is a major concern for us here at Latino Motion and ALMA and AtlantiCare Employee Resource Group. That is why we are partnering to present this health segment. Tu salud es importante para nosotros.
Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. Today we have an important guest to talk about COVID and the vaccine. We have Dr. Manish Trivedi. He is the chairman of the infectious diseases at AtlantiCare. Doctor, welcome to Latino Motion.
Thank you so much.
And I understand that you were the first recipient in the county of the vaccine today, which is the taping of the show, which is December the 15th. An important landmark here in terms of the vaccinations taking hold and first being administered to healthcare providers. Tell me about that.
Yeah, no, this has been a monumental day, I think, for the county, for the state as well. You know, all of us here at AtlantiCare, we're very excited for this moment on the 15th when we receive the vaccines. The whole process and the community and the way that our hospital has kind of come together to really roll this out has been an excellent kind of adventure, so to speak. You know, it's like the light at the end of the tunnel, and you can finally start to feel some relief when we saw the vaccines be delivered.
Now, I know that there's a lot of discussions about the vaccine, that it was rushed, that it may not be safe, et cetera. And you were brave enough to be the first one, leading by example. Why is it important to overcome some of those rumors, if you will? Do you feel that the vaccine is safe?
Yeah, and I think that's a fair way to kind of explain it. You know, there's a lot of concerns about people saying that things are rushed or things are kind of expedited. But this technology has been around there for quite some time. And it's the application into a virus form or a vaccine form that's more new. But the technology of using this type of messenger RNA is what we would call it. That's been there, and we've been deploying that on different things like cancer drugs, chemotherapies, and such. We've used it for other vaccinations as well. So this is really not as rushed as one would think. And, you know, when the world comes together to try to accomplish a goal, a lot of the red tape that usually clogs this up were kind of pushed aside in order to roll out a vaccine that was safe and efficacious for everybody. So being able to step up and be the one to take that was quite an honor, but it wasn't scary in that regard. I had complete faith in the science behind it.
Let's talk about the vaccine itself. Which vaccine was it, and what are the characteristics associated with this particular vaccine?
No, that's a good question. So there's several different vaccines that are in the market or that are becoming more and more available. The current one that we've received the shipment here is a vaccine from a company called Pfizer. And Pfizer created, this is that novel vaccine using messenger RNA technology. There's two companies that do that, Pfizer and another company called Moderna. Pfizer rolled it out, got emergency use authorization. So we've been using that vaccine. We were able to obtain that, and the state's been deploying that. And so that's the vaccine that we use. It uses a technology called messenger RNA. It doesn't give you a live virus. It doesn't give you any actual particle of the virus. You get a little blueprint that gets delivered to your cell, and your cell recognizes that blueprint and makes its own protein to resemble a similar protein on the virus. And that in turn revs up your immune system to develop antibodies.
Are there side effects? I mean, do you get sick as a result of the vaccine?
Yeah, so some of the studies have shown initially about 2% of the population can experience side effects. Now, 2% doesn't sound like a lot, but when you're vaccinating the entire world, it can become higher numbers. But those side effects are fairly manageable, like any other vaccine. You really are getting what's called like a revaccine, like an immune constitution effect, where your immune system is revving up in the after you get the vaccine. And I think that's the side effect that people are concerned about, is you may get a low-grade fever. Some people can get headaches. Some people get nauseous, but thus far I haven't experienced any of those side effects. But again, it's in a minimal amount of people, so it's not something to deter you from getting the vaccine.
So what's the initial plan at AtlantiCare in terms of the distribution of the vaccine? Is it just for the healthcare providers?
Yeah, no. So initially, and we're really going off of state guidance behind this, but initially the vaccine is deployed for healthcare providers and healthcare workers within the hospital system. Really, we initially were thinking of doing a tiered system where you would have patients or people that were in direct contact with COVID, but we sort of rolled it out to allow anyone within the footprint of AtlantiCare to be able to have access to that, because the virus is all around, and we need to protect our families.
Now, I understand that nursing homes, for example, might be the next call, if you will, in terms of the rollout. Is that the case?
That is the case. And what we're finding is the state's really providing guidance for that. We anticipate that within the next 2 weeks or so to have nursing home patients, as well as the healthcare staffs of nursing home facilities, receive that vaccine shortly.
So once it's available to the public, and it seems like that's relatively pretty soon, what should individuals keep in mind? Is that something that they go to their health care provider to get the vaccination? Would there be a specific location that people will go to get the vaccination?
Yeah, I think what's going to happen when it gets deployed out, I think you're going to see a lot of those commercial pharmacies take the initiative to allow people to get vaccinated. We're also going to have initiatives through the hospital system as well, and to be able to vaccinate our community. So between a joint venture between the hospital system and the local pharmacies, to be able to provide that vaccine will be important. Plus, I think some of your local primary care providers will be able to deploy some. You know, right now, the tricky part with this vaccine specifically is storage. You need special freezers for this. So having it in other offices may be difficult, but these big commercial places, pharmacies, as well as the hospital system, will be able to accommodate that.
Now, tell me a little bit about the preparation. This didn't just happen overnight in terms of AtlantiCare. Obviously, the vaccine itself needs specific refrigeration, et cetera. So that was a big task to get ready to receive the shipment and have all the protocols in place. Tell me a little bit about that effort.
Yeah, that started long before the vaccine even was approved by the FDA. And so, you know, the hospitals were selected in the state to have to be given these freezers that we would be able to keep. You have to keep this vaccine in negative 70 degree Celsius temperatures. So it's really, really cold temperatures where normal freezers wouldn't be able to handle that. And so those were deployed to 5 regional hospitals. Our hospital was selected, of course, because of the community that we have, as well as the work that we're doing. And so that was all in place. And then once we got the go-ahead, it was a huge task. Our pharmacy department did an excellent job of obtaining the vaccines and being able to mix them in-house and deploy them.
Now, I understand that this is not just one shot. It's multiple shots. Tell me a little bit about that. What's the timing?
Yeah, so a lot of these vaccines are two shots. It's two steps. The first shot initially is to prime your immune system, and the second one is to give it that boost to give you longer lasting antibodies. So the first shot typically is on your first day whenever you get called to take the vaccine. And then your second shot is roughly around 21 days or so subsequently after. And that shot should complete your virus vaccine set. After that, you have to wait roughly around 4 weeks or so for your body to build adequate immunity so that you have that effect.
So once you get the immunization, are you able to basically go out without fear of getting the virus?
Yes and no. And so it's not a substitute for washing your hands, not a substitute for wearing a mask or maintaining that physical distance right now. Having the vaccine is 95% or so effective in preventing serious illness or even preventing the disease from progressing. That's a huge milestone achievement. So the fear of suffering really gravely from the virus itself should be alleviated, but it's not a substitute for not wearing the mask at all. You can still end up spreading the virus even though you've been vaccinated, because the virus can go inside your nose, go inside your airway, and then you can spread it to other people by breathing. So that's the important part.
Yeah, very important points that we want to continue to touch base upon. We need to take a quick break. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on YouTube, Facebook, and Twitter. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. We continue our discussion with Dr. Manish Trivedi. He is the chair of infectious diseases at AtlantiCare. And doctor, we were talking about the vaccination, you being one of the first to get the vaccine in Atlantic County, along with 55 other healthcare providers at the hospital. We talked about the fact that once you get the vaccine, it doesn't mean that you should let go of all precautions. And I understand you also are co-chair of the Infection Prevention and Control. So no better person to ask this question. What safeguards should we continue to take in spite of the fact that the vaccine is available?
Yeah, we have to think about the vaccine as a tool. It's just another tool that we've been using. Currently, we have the most effective tools, which is wearing the mask. The mask helps prevent the spread of virus, but it also helps prevent getting the virus. It helps keep your neighbors and families safe. So if you have to be out in public, if you have to be around people, to continue to wear the masks at all times. Also maintaining that physical distance and washing your hands. Between those three, the additional vaccine is an effective tool to help prevent the spread of this virus.
So it'll be a shame, right, that we're this close to getting the vaccine available to everyone, for someone to get sick right when we're reaching that milestone. We're entering the holiday season. What's the important message that you would give to our audience in terms of how they should manage their celebrations, et cetera, and keep safe?
Absolutely. It would be a tragedy, especially with the vaccine. And as I like to say, help is around the corner. It would be a tragedy to suffer from the virus during these times. You know, family is the most important thing amongst AtlantiCare and amongst the families of our staffs and patients. And, you know, you want to be around them during these holiday times, but the best way to protect your family is to be safe about it, to continue all the preventative measures I mentioned, wearing a mask, and try to limit all of the gatherings and celebrations. If you can do that and wait for the help to be around the corner, I think we have brighter times to come.
Doctor, I know that you also inform in terms of the testing. Someone that may not feel good and should take the precautions, where can they get tested here in Atlantic County?
Yeah, so we have multiple spots to get tested now. Initially there was always concerns, where can I get tested? How can I get tested? Now it's much simpler. The urgent cares of AtlantiCare systems offer testing at an array of different times. We have an access number, a hotline on our website at AtlantiCare that allows you to call in to make those reservations and appointments, and also be guided as to where to get tested. Also, the primary care facilities around our hospital system offer testing as well. So there should be ample testing for all of our community members.
And I know in the other counties, our surrounding counties, in Gloucester and Cumberland counties, their local county health departments can certainly provide testing information as well, because it is readily available throughout South Jersey at this point in time.
We're helping each other to try to arrange for that. So, yeah.
Tell me the difference between the regular testing and the rapid test. And I know some people are seeking the rapid test because they have to travel or whatever, but what's the difference?
Yeah, so there's two types of tests that they're currently offering. One is called a PCR test. A PCR is a very sensitive test, and it detects viral particles. The unfortunate part about a PCR is that even though you may have had the virus, let's say several weeks ago, it can still detect shedding of old virus or dead virus particles. So you may not be infective, but you may test positive, and that becomes tricky because you have to know your symptoms. The antigen test is a lot more readily available, and it's a rapid test. You have answers back within 15 to 45 minutes. It's really an excellent test if you're symptomatic. If you're symptomatic, it's about 93 to 95% accurate. If you're asymptomatic and you want to just get tested for the sake of testing, that's where the drop-off falls a little bit. It's in your high 80% accuracy in that. So that's kind of the major differences of those two testings.
Now, if you have a family member that is positive, what's the usual protocol in terms of trying to stay safe yourself and being able to care for someone that's sick?
Yeah, no, absolutely. So what we if you have a family member that's self-sufficient, to be able to quarantine and isolate within a room in your house, something where you have your own bathroom per se, and you can eat your meals in your room, so that you literally don't leave your room for 10 days or so. But that's not often feasible in our community. And so oftentimes you have to share living spaces and such. And so in those circumstances, both parties, the person, the patient, as well as the person taken care of, should be wearing a mask at all times. That prevents the spread of virus and brings down to less than 2% possibilities of getting infected. Of course, washing your hands always whenever you're caring for each other. Try to not eat with each other in the same room, because you can certainly spread that virus during that time.
This is great advice. And I want to change gears a little bit, because I understand you born in Atlantic City, you were raised in Galloway. You're the doctor in charge of infectious diseases at Atlantic County here in your hometown. Tell me a little more about yourself and how you got started in the medical field.
Yeah, of course. So, I was exactly as you mentioned. I was born in Atlantic City Hospital many moons ago, and I was raised in Galloway. I went to a high school locally at Apsey-Gammey. I ended up going to Cornell University in New York, and then went to a university abroad and came back for residency in North Jersey in Morristown. Then I did infectious diseases at North Shore Long Island Jewish in New York. I spent some time there in New York. I did transplant infectious diseases at Mount Sinai in New York. And then I wanted to travel a little bit. I thought I would offer my services and see the world a little. So I did Doctors Without Borders. I was in Sudan, Darfur, for a little while, and realized, my father was a physician here in South Jersey as well. And he told me, you're going all over the place to help when there's people in your backyard that you could certainly help as well. So I decided to come back home and have been here since.
Just give me a message that you will give to our youth, but particularly our minority kids and students, if they're pursuing a medical career.
Absolutely. It's certainly a rewarding career, and always seize the moment. Throughout my life, just in the community, we've had a lot of different events occur, and I think the community it looks at each other as a family, and always to reach out, look for help when you need it. But the opportunities are there, and certainly seize those moments, because there's no telling how far you can go.
Well, thank you so much. I'm glad we had you on the show. Glad that we had someone that was born here and local to our community to share this very important message with our audience. We're going to take a quick break and we'll be back with another guest. Thank you, Dr.
Thank you.
Trivedi. And we'll be right back with more Latino Motion. Welcome back to Latino Motion. My next guest is Lynette Morales. She is a board member of the Hispanic Association and also a member of the Three Kings Committee. Lynette, welcome to Latino Motion.
Thank you.
We're here to talk about an important celebration in the Hispanic community, and certainly one that's had a long tradition in Atlantic County as far as the Three Kings celebration. Tell me a little bit about what the plans are for this year, given that we have the COVID crisis.
Sure, definitely. The Hispanic Association of Atlantic County for 20 plus years has continued to promote and celebrate the Three Kings celebration. This year, we're doing it, of course, a little bit different because of the COVID and what is going on. What we're planning on doing, we are still going to celebrate it at St. Michael's Quaremba Hall. We can only have 10 people at a time inside the building. So the plan is, so far what we have done is we have split up the day on different times where people actually have to sign up for a time to come in to pick up those gifts.
Let me just stop for a second there. So I know in the past there's been a big celebration encompassing part of the Catholic tradition, right? There's been a nativity scene with the church. So all of that celebration, unfortunately, we had to put on hold.
That's
but
correct.
we still thought it would be important to do the toy distribution for many of the kids, particularly kids that may be in need in Atlantic City.
That is correct. That is correct. We totally think that it's important that we still have this celebration for the children, even though what is going on with COVID. So we're working around all those guidelines that are, put into place because of the COVID. We want everyone to be safe and feel safe, but we still want to do that celebration based on the guidelines with COVID, right? Correct.
So let me just indicate that the website, and I know it may be, we'll put it up on the screen, but
Yeah.
if you wanted to register, you need to go to the website. You need to pick up a time slot. And again, you will be able to come over to St. Michael's on Georgia Avenue, which is the back of the church. And essentially, you could stop there and pick up the toys for the family, for the kids. So tell me about what's in the registration. What kind of information do they need to provide?
In the registration, you will need to provide your name, your phone number or cell phone number, your email address, how many children, and the ages and sex of the children.
Right, and hopefully the Three Kings will be hard at work, putting the toys together aside. We just had, I understand, when shopping for some toys, there have been donated, organizations that have donated for the toys. You want to tell me a little bit about those donations?
Sure, definitely. We've had a lot of big companies like AtlantiCare donate funds for us to be able to go shopping for these gifts, right? We're actually helping the Three Kings shop for the gifts for the children.
The CRDA has come in a big way to support
Horizon.
the Hispanic community, and Horizon as well has come in big. There's AC DevCo, Atlantic Cape Community College, Stockton, and South Jersey Gas. And we've had some individuals like Evan Sanchez and Arlene Gonzalez, et cetera, that have also come through providing some funds to be able to purchase the toys. Now, Lynette, I know that we're kind of old, but when we were kids, we celebrated the Three Kings, and it's so important that we continue to pass that tradition. I remember in Puerto Rico where I took a shoebox and we would get some grass, we put it under the bed, then you walk up in the morning and you look under the bed to find the gifts that were left over from the Three Kings. It was such a nice event and warm memories that I share, and you have similar memories.
Correct. That is exactly it. The Three Kings celebration is almost the same as the Christmas Day here in the United States. To us, our Latino community, all over Latin America, Puerto Rico, Dominican Republic, Cuba, and Spain, we celebrate it as big as the Christmas Day. You know, just like you said, I'm from Puerto Rico also. I also did the shoebox with the grass and, you know, under the bed, and the next day we will get our gifts. I know that Mexico has different traditions. I believe the kids put the shoes there, and then the next day they also get the gifts. But it's such a big tradition, and you know what I like the most about this is that we want to promote it within our community. We want our children to learn about it just the way that we did, and we want to continue promoting it and continue for them to learn about this tradition and be able to celebrate it while here in the United States.
Yeah, just going back to Mexico, the way they celebrate it, keep in mind that in Mexico, this is one of the oldest traditions since the Spanish colonial times that has continued all this time. And obviously important that although may not be as popular in the United States, it's important that we keep that tradition alive here for our community. Certainly the Hispanic Association is making every effort to make sure that it continues to be alive here. Let me ask in terms of the age groups, and let's talk about the hours of the event. So toys will be available for what age group?
Up to 13 years old.
Up to 13 years old. And again, it's Saturday, January the 9th. And the hours that we have here is 10 a.m. to 2 p.m. Is that correct?
That is correct. The hours are going to be from 10 a.m. to 2 p.m. on Saturday, January 9th. It's going to be at St. Michael's Quaremba Hall, 10 North Mississippi Avenue in Atlantic City. We're asking everyone to pre-register just because we don't want, because of the COVID guidelines, we don't want a lot of people at the same time. So we need everyone to register in order to have control of the crowd, right? So if anyone, there is a link to register online, but if anyone needs help registering, they can call me at 609-380-3106. 609-380-3106, and I would definitely help anyone that needs help registering, or giving the link to the website where they can register.
Now, I understand that the Three Kings will still make an appearance, right? Even though we have COVID, unfortunately, they can't get as close to the kids and be able to take the fun pictures that we always had. But we do have some volunteers who will be dressed up as Three Kings and be able to greet the kids, correct?
That is correct. The Three Kings will make their appearance. They will be there.
All we ask is that people wear warm clothes, since we try to do this as quickly as possible, getting people in and out. But there may be a little bit of a wait outside because they're limited a number of people that could come inside the church. Lynette,
we may have some people have to wait outside, because we're only allowed a certain amount of people inside the church.
Lynette, thank you so much. So it's always a pleasure to have you on the show to talk about these important celebrations. And unfortunately, that's all the time we have. I want to thank all of you at home for joining us here on Latino Motion, and wishing everyone a Merry Christmas and a Happy New Year.
Choose to get your feet wet, to learn more about protecting our environment.
Choose to read minds,
to understand the human brain.
Choose to get your hands dirty to create a masterpiece.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Funding for Latino Motion is provided by AtlantiCare, offering primary, specialty, and urgent care, plus surgery and more. Atlantic City Electric, energy for a changing world. And South Jersey Gas.